Welcome back. This is Minda Wilson with Urgent Care. Today I'm excited to bring back my good friend, Tal Givoly, whose company Medivizor is really an important tool for people to get reliable, clear, and personalized info about your condition. And we've talked about this in prior shows, so the first thing I want to do is sort of find out how, since we've last talked, what the impact of Medivizor has been and how it's impacting people's lives.
Thanks, Minda. Thanks for having me again. So I'm excited to report that we're now helping about 200,000 subscribers. These are all people dealing with serious or chronic illness. And what we help them is, I call it now, radically empowering patients. Because we empower them and give them the latest medical science, something I don't believe anybody else is really doing. Access to the latest clinical trials, the latest guidelines, treatment options, so they could quickly and swiftly know what's the latest stuff for them in a way they could understand and act. And now we're doing that across 23 therapeutic areas, most of cancer, cardiovascular disease, diabetes, Parkinson's disease, and more. So excited to be able to bring that sort of information to people.
And information is power, but there's good information and bad information, and sometimes too much information that can be overwhelming. How should people sort of navigate the field? How do they assess those things?
That's an excellent question. It used to be like maybe 20 years ago, access to any information would have been difficult. Today, we're in overabundance. The pendulum has completely shifted in the other direction. There's just so much information. So whenever people put in their diagnosis and search it on Google, which 87% of people do after they get a diagnosis, you probably hardly know of anybody that wouldn't. They get overwhelmed with so much. Much of it is repetitive. A lot of it from good sources. So there's very well-known websites, but the thing is that that's repetitive and generic. And then if they're looking for cutting-edge information, that's when things get scary. That's when they don't know whether to trust it or not. And does it really matter to their situation, their specific situation? So it really takes a careful ability to discern what is relevant and trustworthy and how to make use of that. And that's what Medivizor tries to make accessible to everyone. We don't want to overwhelm people. We give them only those things that are relevant to them. And it's less than 1% of the published research that we actually bring in that we find that is good and of clinical relevance to patients.
Walk me through it. So I get a diagnosis. I find out I have heart disease or cancer. How do I find you? I mean, how do you get people to find out about you so that they know, other than coming to our show, of course, how do people find out about Medivizor as a trusted source?
So there are several ways. One of them is through search. We're top search result on Google, and over 100 keywords in first page result on over 1,000. The second is social. We have over 120,000 fans and followers on Facebook and Twitter. So we're constantly publishing content on the conditions we cover. And third, and most importantly perhaps, is we're distributed by healthcare providers and patient advocacy groups. So there are leading healthcare providers and leading patient advocacy groups that are actually giving Medivizor to patients every day. We even have our widget. It's like a little portal, a mini portal on the web on other people's sites. So they could basically start signing up from a bunch of places. So all of these are referring patients to Medivizor. And from time to time, you and I talk, and some people may listen to this and they know that it's possible. So it's also here word of mouth. But mostly those three sources that we just discussed.
So they'll see Medivizor. They'll see a bunch of things. how do they make the decision? What criteria should they use to say, oh, let's pick Medivizor versus a lot of the other things they see? Do you
Well,
understand?
first of all, yeah, sure. First of all, it's not an either or. People should try different places to get information. I'd encourage everybody to be empowered and learn more and navigate their care. As a caregiver myself for my daughter, I absolutely know that it's vital for patients or their families to be the quarterback of their own care and to help navigate. So knowing more is power, and being able to guide the care gets better outcomes. Now, you don't need to choose. It's not like you need, if you choose Medivizor, it's a free service, it's private. You could sign up to Medivizor. You could also read on Wikipedia and on WebMD and sign up to another online patient community. The thing is, what do you do with the information you get from all of those? And ultimately, you start developing more trust in the resources that you see as delivering better value for the time you invest in them. And that's where Medivizor kind of excels. We bring only credible, cutting edge information that's personally relevant to you in a way you could understand and act. So that's so very quickly we would emerge as one of any subscriber's top sources of information, if not the top source.
But that's one of the key things that people are really looking for, which is the answer to the question, what should I do? I think
Right.
that's the most troubling thing. You know, you can read about what causes the disease, how it progresses in the body, but what do I need to do to take care of my loved one
Right.
and make them feel better? That's the critical question that people are asking.
Absolutely. People are really confused. There's just too many things. Should I go on this diet or that diet? Should I take this supplement or that supplement? Should I go on this treatment or that treatment? Should I? All of these choices are really making it difficult, and they hear things like press it here, use this technique, and they don't know if it's going to work, if it's going to help. So they either shut down and don't look and don't learn, or they find a good resource, or they just trust their doctors. But I would encourage anybody to develop a better understanding. And I could tell you more about like how could they discern if what they're reading is
That
useful.
that would
Well,
be great. How do they discern if what they're reading is useful?
so first of all, it needs to be good research, not things about, that they hear about on lab rats or in petri dishes. It needs to be clinical trials conducted on humans or large studies in reputable journals. They need to understand, and reputable journals meaning it has it's a brand name in the scientific community. They need to look at reviews of that article. They need to understand it. They need to also learn how to read those things. Now we help with all that. So if somebody, it has taken me a while to learn how to understand all this literature, but people using Medivizor don't need to, because we boil it down to them to 300-word ninth grade English summaries. So they could actually understand this. But in other sources, they need to find interpretations of it. Too much of what we see on headline news is just totally rubbish. It's really important to understand that in general, the medical scientific process takes 2 steps forward and 1 step backward. So there's, for every few good research papers, there's a few that are really bad and confusing. So the more patients are involved, the better the research is, the better the reviews of that research are, and the more people like Medivizor that distribute that information to patients, the better it is.
Right, and there's also, if it's too good to be true problem, it probably is too good to be true.
Yeah, it's very
So,
rare that there are like breakthroughs in the degree, in the sense that the disease goes away, or reversal of a disease can completely cure of metastatic conditions and so on. They are very rare. They do happen. So it's not, but it's very, very rare. And most of the things that make breaking headlines are actually not going to affect patients for the next 5 years, if they're true at all.
Right. It's an initial finding that looks promising that
Right.
people have disseminated, but they don't have the science to back it up. And what you're saying is that make sure when you look to something, there's the science to back up the claim, that it's not just a claim.
Right. Right. So it's and usually now there's a big problem in general. In scientific research, a lot of the research is funded by the interested parties, by the pharmaceutical companies, because they fund so much of the research because it's required for them to get their medications approved. It's very important to understand what happens with that over time. And our subsequent research, do they support the original findings, or do they dampen the impact of those results? And are there new things that are less than researched? I'll give you an example. Magnesium supplementation. There were over 160 clinical trials performed on magnesium supplementation. There's almost no commercial entities that would benefit from this research. And it's very hard to know whether you should do something with that. So that's the sort of thing, but there are very good clinical results for a number of medical situations, including depression, ADHD, autism symptoms, anxiety, and I could go on, muscle cramps, insomnia. All of these things are affected by magnesium, for example. But you wouldn't find that being prescribed often by doctors. And things like that are things that Medivizor could make available to the people for which it is relevant. Mm-hmm. It's among there. Just so for perspective, there's over 1 million peer-reviewed journal articles published each year.
Wow.
That's
Who knew?
Yeah. Just in diabetes, it's 42,000 peer-reviewed journal articles published last year. And that's more than 100, 20-page journal articles falling on a virtual desk of a doctor every day, including weekends and Thanksgiving and Christmas and everything. And just so you know, last I checked, there were 1,688 clinical trials recruiting breast cancer patients. So these are 1,688 different clinical care options, different things that somebody with breast cancer may choose to do. And unfortunately, the doctors don't have the time, the tools, or even the motivation to help their patients navigate and find the best care.
So they go with the tried and true 80%. They use the 80% rule, and if you're in that 20%, then you have to try the first thing first, which may not be good for you. You may know that you have something that would make that chemotherapy that they're suggesting not work, but they may not have done.
Yeah. And by the way, every treatment and every choice you make, every action you take, if you start treatment like a chemo or surgery or whatever, or radiation, whatever choice you make starts restricting and limiting your options. Because you suddenly become ineligible for a whole slew of potential treatments.
So how does that work? Explain that to me a little bit more.
Right. So each of these clinical trials has very strict eligibility, inclusion, and exclusion criteria, sometimes like 80 different conditions. So you might need to be on this treatment, off that treatment, healthy enough, but or sick enough, or too sick, or sick enough, or with or without these other comorbidities, maybe some genetic markers. All of these things need to fall into place. But the minute you choose a treatment option, that means, okay, now you've received. So some of these these clinical trials need you to be treatment naive, meaning that you have not received treatment. Okay. Some of them require you to be after 2 lines of standard therapy. So you're only admitted after you've tried several things, but they're no longer working for you, for example. So the thing is that the doctor doesn't have access to this list of clinical trials. Really, they can't verify it for each patient. They can't consider what are the other therapeutic options besides what is called the standard of care for your circumstance. And that's where empowering the patient and their family is really paramount. I would urge anybody that to be informed as possible so that they know and consider all these options.
And can a patient apply for a trial themselves, or do they need the participation and the support of their doctor?
First of all, they can apply to the trial. Okay. In fact, in Medivizor, there's a button called Apply that people could basically start the process to get to the trial. And we've connected over 1,000 patients to clinical trials. So
Wow.
People could basically start signing up directly. That's one thing. The other thing is usually down the line, they do need their doctor support, and they would actually want to get the doctor's opinion.
Mm-hmm.
What do they think about that trial? Do they think it will help? The doctor, after all, knows medicine much better than the patient, but the patient knows themselves and has the highest motivation to find the best care options. So together, the ideal situation is when there's good support for one another and they're on the same page and they communicate about their options.
But it allows you to sort of take the reins, like do the first cut. If there's something you think you qualify for, you can go to Medivizor. You can review it on Medivizor, remembering that it's reputable people that are involved. Make sure it's it's an institution and that's of good reputation, and has been vetted. And if it is that, and it's something that you think you may qualify for, you could do the first cut to see if you have the opportunity to participate. And if you do, then you're supposed to go to your doctor and say, hey, look, I've been considered for this. What do you think?
Right. You could actually send them in Medivizor process, there's a step where you could actually send the information about the trial to your doctor and have them confirm the eligibility criteria. So that would give you an opportunity to have that discussion with them. And we actually in Medivizor don't inform you about clinical trials that you might not be eligible for. So we first only provide you information about those trials we think you might be eligible for. There still may be things we don't know about you because you asked how the process is. So after you find Medivizor, you sign up. It's a free and private service. You tell us a lot about the medical circumstances of whomever is dealing with a serious or chronic illness. And then we personalize the health information from that point on as a sort of lifelong subscription service. So, but you will get informed about matching clinical trials, and if they sound interesting, compelling enough, you could take the next step, and the doctor would be involved in that step.
And the thing that's interesting is, like, even if you've had a disease like cancer or heart disease, and you've had a procedure, as you pointed out, your life changes because you've had those procedures. So if you've had a bone marrow transplant, once you've had the bone marrow transplant, you live a different kind of life than you did before you got sick. Mm-hmm. So there's other things that you need to follow up on. It's a lifelong journey. It just doesn't end once you've had the bone marrow transplant.
Right. Absolutely. So that's why we deal with serious and chronic illness, because that's a situation where you're not just concerned about some acute thing that happened. I don't know, a kid breaks an arm or something that happens, and then you treat it and it goes away. People that are affected by serious or chronic illness, for them it's a lifelong issue. They become what I call chronic web researchers. They start spending, some of them, not everyone, some of them ignore it, some of them, just say, okay, I trust a doctor, I've hired a doctor, they'll help me. Some of them try to, bury their head in the sand. But the wise ones start learning and brushing up and knowing and becoming smart about the situation and navigating it. It's not everybody, but it's a growing proportion of people.
Mm-hmm. And so when you say serious and chronic illnesses, what do people do who have chronic pain as a result of an illness? Does it have to be illness specific, or is there a category that they should be looking at? Because
Right.
opioids is a big problem, right?
Right. So first of all, I'd wish we had we had support and coverage for all conditions. We currently don't. Chronic pain, fibromyalgia, chronic fatigue syndrome, all of these are potential conditions to be included eventually in Medivizor. We are actually seeking industry to sponsor these conditions. We supported the first 14 conditions on our own dime, but the remainder were paid for by industry without biasing the information we provide patients.
Mm-hmm.
So we're seeking sponsors that would support those conditions. They could actually make a donation to a patient, to a nonprofit that would work with us, and we'd partner to do this together.
Mm-hmm.
But that would be how we add coverage to these conditions. Right now we don't, but essentially you would be able, for example, there's chemo brain that is a result often of chemotherapy across oncology, across various cancers. So that is, for example, something people get information about on Medivizor.
Mm-hmm. Interesting. It's not just the process you go through to get well, it's the I guess the remnants that you have after you've gone through the therapy, and how you cope throughout life once you've had the therapy, once you've had these invasive therapies.
Absolutely. Yeah, and by the way, when you say that let's say you have previously been diagnosed with and treated for a cancer. Okay,
Mm-hmm.
now you have no evidence of disease, or it's called remission, or no evidence of disease. Still, the information in Medivizor is tailored for your situation and circumstance at that point.
Mm-hmm.
Things like how do you improve your life now? How do you prevent recurrence, and so on? How do you minimize the likelihood of recurrence, and so on? How do you deal with those, as you said, remnants or byproducts of your illness, and so on?
Right. So, for example, let's say you have a heart disease and someone puts in a stent. They may not know that for the rest of their lives they have to take antibiotics so that they don't get an infection, or they may not be aware that there are other things they should be doing to prevent themselves from getting other problems that happen to people who've had the procedure that they've had. Is that correct?
Right. Right. Absolutely.
So by going to Medivizor, it's not just in the moment when you're struggling with a particular issue that is, affecting you like cancer, but it's also the long-term treatment that you need in order to make a healthy life for yourself once you've passed the critical phase of your disease.
Completely agree. That's exactly what it is. That's why it's a lifelong subscription service, because it adjusts based on your specific situation, which may be that you're well, but now you're dealing with the side effects of your medications, and so on.
And this service is free. So if somebody wants to sign up, how do they?
Yeah, they just go to medivizor.com. It's spelled medivizor.com, and there's a place there to sign up. We currently help people with 23 therapeutic areas, and if it's not listed there, you could sign up and just you'll be on a wait list and be notified when we do add condition to Medivizor.
And people don't have to worry. Their information is secure. It's not sold to other parties.
Right. The information is private. We don't provide that information to others. They could always unsubscribe. And the only identifying information we actually have about the patient, we don't have their name, telephone number, social security, address. The only identifying information is an email address, which you could actually use a burner email. In Gmail and Yahoo Mail and many other services, you could fabricate an email address on the spot and have it routed to your inbox if you are really concerned. But again,
very clear to people, their privacy is protected.
Yes.
So you don't have to worry that somebody somewhere on the internet is going to find out that you're sick, or find out the specifics of your disease. And they're very secure, so you're not going to worry that somebody is going to break into their database and learn all about you through that. Correct?
Correct.
Yeah. So it's really great talking to you again, Tal. I appreciate you coming on the show. Medivizor provides an amazing service, especially with people struggling with illness over the course of their life to help keep them healthy. And we look forward to having you back again.
Thank you very much and have a great day.
Thank you. This is Minda Wilson with Urgent Care.